the way I conceptualize eating disorders as really existing on a continuum, because all of us in one way or another have body image concerns, and generally those fall somewhere on the continuum, with our eating disorders lying at that extreme end. In some ways, eating disorders, when they first develop, are often an adaptive coping mechanism for the individual. They at times are the best way in a certain situation that the person knows how to cope at that time. What's happened over time is that the different behaviors that they end up engaging in have become very, very maladaptive and have begun to interfere with all of the different areas of their life. Individuals with anorexia, bulimia, or binge eating often struggle within the context of their family system, and their families are very much affected by their struggles. And family being loosely defined as their immediate family, their partners, or their friends. So the program participants coming into our partial hospitalization program and our intensive outpatient program come in with different expectations depending on the level of care they're coming from. Someone who has not had any treatment and they're coming into intensive outpatient or partial hospitalization for the first time, they are often very fearful of what treatment will entail. For individuals stepping down from residential treatment or from inpatient treatment, they often have a better idea of what to expect as they come down to partial hospitalization or to an intensive outpatient program. As much as they want to get better, there's also an incredible fear of what the steps are that they need to take. Once they've engaged in treatment and have been in our program for a little while, they really build up a hope that isn't there when we initially have them come into treatment. After your initial contact with our intake coordinators, I will be the person that does your intake assessment with you. I will be involved in your treatment from the first day you walk in our doors. A typical day for us is 8 hours a day. It includes 2 supervised meals and a snack, and then therapy groups and individual appointments as well. Our treatment program incorporates all of the leading empirically based treatments that we know are effective for eating disorder treatment, including cognitive behavioral therapy, dialectical behavioral therapy, family-based therapy with the adolescents, as well as integrative therapies. In addition to those skills-based groups, we include dance movement therapy, art therapy, qigong, and stand-up paddleboard yoga. When you admit to Nudon, we develop an individualized treatment plan to meet your unique needs and goals. If you're interested in admitting to Nudon, you can call one of our intake coordinators to set up an intake assessment, and these are done either over the phone or in person. Your family and or your healthcare providers can also initiate those phone calls. So our hope for our patients when they finish treatment is that their eating disorder will no longer be that all-consuming focus of their lives. Our clients, when they often come into treatment, have very little realization of their strengths and of their goals and of what amazing young women and men that they are. And they are some of the brightest, most intelligent, funniest people I've ever met. Over time, to see them recognize those strengths within themselves is absolutely inspiring and keeps me doing the work that I do.